Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
complications of different positions. Peripheral neuropathy. In the peripheral neuropathy, ulnar nerve neuropathy is more common than the brachial plexus. Ulnar nerve neuropathy is 28% more common, whereas brachial plexus is seen in 20% of patients. Venous embolism can occur mainly in the sitting position. Venous embolism. In venous embolism, it occurs in sitting position, especially in the surgeries related to posterior fossa or posterior cranial fossa. So, in venous embolism can occur due to 100 ml of air or 3 to 5 ml per kg of air. Diagnosis of venous embolism. In diagnosis, transesophageal echocardiography. Transesophageal echocardiography is most sensitive and we can quantify it. This transesophageal echocardiography is first diagnosed, followed by non-invasive Doppler can be used, followed by EtCO2 can be used, followed by mill-wheel murmur. ETN2 is most specific. Treatment of venous embolism is stop the nitrous oxide and then pack the area. You will have to treat the arrhythmias should be treated, and we have to aspirate from the cardiac chambers. Left lateral position should be used in the patient to prevent any paradoxical embolism, especially to reach the left side of the circulation. So it is better to do the surgery in left lateral position, or put the patient after surgery in left lateral position. Summary: complications of different positions. Peripheral neuropathy. The most common nerve involved in peripheral neuropathy is ulnar nerve in around 28%, followed by brachial plexus in 20%. Venous embolism, second complication. Venous embolism is mainly seen in sitting posture, that too in the posterior cranial fossa surgeries. Venous embolism can occur even due to 100 ml of air or even 3 to 5 ml per kg of air. Diagnosis is done by transesophageal echocardiography, which can quantify, and it is most sensitive. It can detect even 0.02 ml of air can be detected by transesophageal echocardiography. Followed by non-invasive Doppler can be used, followed by EtCO2 is increased in case of venous embolism, and Millville murmur is also seen. ETN2 is most specific. Treatment is stop the nitrous oxide and then pack the area, treat the arrhythmias, and if there is any gas in the cardiac chambers, it is better to aspirate the cardiac chambers for the gas. Put the patient in the left lateral position in order to prevent the paradoxical embolus, because if the patient has any right to left shunts, then the embolus from the uh, right side of the heart can go into the left side of the heart. In order to prevent that, we put the patient in the left lateral position.
thank you and thank you for watching.